Welcome to Week 6, Chapter 17, Nursing in an Evolving Healthcare Delivery System. The objectives for this week include examine the issues of cost containment and access to healthcare as they affect nursing, differentiate health, wellness, and well-being, compare selected models of health, identify factors affecting health status, beliefs, and practices, and identify selected issues related to nursing and healthcare economics. The key terms for this week are health, wellness, cost containment, delivery systems, and managed care. Some of the challenges and opportunities of healthcare today are the changing paradigm of healthcare. Rising healthcare costs lead to cost containment. We're forced to do more with fewer resources. There's a commitment to high quality care, which challenges nurses to find ways to provide care with fewer resources. Nursing can create new roles and redefine nursing. That is one of the opportunities. The selected issues include that nurses can be involved in include cost containment and access to health care. Cost containment strategies include resource management basics. That means that includes financial, physical, and human resource management. Interdisciplinary plans for managing care include utilization of clinical nursing assistants. It's a controversial attempt at resource utilization because it relieves the professional nurse of tasks, but then they're delegated to others. So we have to remember, as a professional nurse, we have to make sure that delegation tasks can safely and be effectively performed by the clinical nursing assistants. Also, access to health care. As far as a cost containment strategy, it's estimated 45 million Americans were uninsured in 2009. The estimates believe that 54 million Americans will be uninsured in 2019, but I am sure that has changed with the Obamacare. There are certain barriers to accessing health care, and that includes cost of care, lack of insurance, problems with insurance, difficulty getting appointments, difficulty finding the services needed, and lack of transportation. The nursing's agenda for healthcare reform include effective healthcare should be cost-effective, community-based. Access to healthcare is a basic human right, so we need to restructure the healthcare system to ensure universal access to standard healthcare. Access should be affordable, available, and acceptable. Community nursing is a shift from the centralized biomedical model to community-based holistic model. This will help control cost. Concepts of health, wellness, and well-being are health is traditionally defined as presence or absence of disease. The World Health Organization definition is health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It reflects concern, the World Health Organization definition reflects concern for the total person. It places health in the context of the environment and equates health with productive and creative living. Dubos viewed health as a creative process, which means it's included in his process quality of life, social, emotional, mental, spiritual, and biological fitness are included. It's a result from adaptations to the environment. It's believed to be a complete well-being, and that a complete well-being is unattainable. The individual must have sufficient knowledge to make informed choices, and income and resources to act on those choices. And the American Nurses Association defines health as more than absence of disease. It includes striving towards optimal functioning. More concepts: wellness and well-being. Wellness and well-being is the process of identifying needs for improvement and making choices that facilitate a higher level of health. There's the basic concepts of wellness and well-being include self-responsibility, ultimate goals, dynamic growing process, daily decision-making, and whole being of the individual. Illness is a personal state of feeling unhealthy. It may or may not be related to disease, and it's very subjective. Disease is an alteration in body functions resulting in reduction of capacities or shortening of the normal lifespan. Disease prevention is defined as taking action to avoid later disease. There's 3 levels of disease prevention, and the levels are primary, secondary, and tertiary prevention. Models help assist health professionals meet health and wellness needs of individuals. Models of health and wellness include Livell and Clark's agent-host environment model. It's a traditional approach to health. They address communicable disease. It's used primarily to predict illness. There's 3 dynamic interactive elements in their model, and that is the agent, the host, and the environment. These factors are constantly interacting with the others. This model also believes that health is an ever-changing state. When in balance, health is maintained. When not in balance, disease occurs. Dunn's level of wellness is an interaction of the environment with illness and wellness. There's a health axis that extends from peak wellness to death. Environmental axis extends from very favorable to unfavorable. There's a health and wellness continuum, and there's certain dimensions of health, which include physical health, intellectual health, social health, emotional health, environmental health, and spiritual health. Once again, there are dimensions of health. Health status, beliefs, and behaviors. This is more concepts. Health status refers to state of an individual's health at any given time. Health belief is the perception of the relationship between things such as actions or objects and health. Health behavior are actions people take to reach their maximum physical and mental potential. There are also health belief models. One of the health belief models includes the health locus of control model. That is that health is internally controlled, believe they have a major influence on their own health status. Also, externally controlled, where the belief is that health is controlled by outside forces. Rosenstock and Becker also have a health belief model, and it's based on the motivational theory. It's assumed that good health is an objective common to all people. There's 3 components. The first component is individual perceptions. Second component is modifying factors, and the third is likelihood of action. The individual perceptions are related to susceptibility, seriousness, and threat. Modifying factors include demographic, socio-psychological, structural, and cues to action. The likelihood of action refers to benefits of action and barriers to action. There's also an international initiative for health and wellness. Health is for all is an international goal set by the World Health Organization. There's global priorities and targets, and the global priorities and targets include increased life expectancy, increase in quality of life, improve equity and health between and within countries, and ensure access for all globally. The key values for global health are highest attainable standard of health is a fundamental right, strengthening application of ethics, implementing equity-oriented policies and strategies, and incorporating a gender perspective to health policies and strategies. A global initiative is vaccine preventable deaths and global immunization vision strategy. The goal of this is to protect more people, introduce new vaccines, integrate immunizations with other health interventions, and create global partnerships to help ensure that to improve healthcare for all countries. The Global Program on Health Promotion Effectiveness is GPHPE. It aims to raise the standards of health promoting policymaking and practice worldwide. In the United States, we have goals for health. I'm sure you're all familiar with Healthy People 2010, which was published by the United States Department of Health and Human Services. In 2010, the 2 broad goals were to increase in quality and years of healthy life, and also elimination of health disparities. Great strides have been made during the past decade since Healthy People 2010. Life expectancy at birth has increased, rates of death from coronary artery disease and stroke have decreased. Nonetheless, public health challenges remain and significant health disparities still exist. In December 2010, the Department of Health and Human Services launched Healthy People 2020, which has four overarching goals. They include attain high quality, longer lives free of preventable disease, disability, injury, and premature death. The second goal is to achieve health equity, eliminate disparities, and improve the health of all groups. The third goal is to create social and physical environments that promote good health for all and promote quality. The fourth goal is to promote quality of life, healthy development, and healthy behaviors across the life stages. So, Healthy People 2010, the major public health concerns include increased physical activity, weight management, reduction in tobacco and substance abuse, responsible sexual behavior, promotion of mental health, reduction of injury and violence, and improvement in environmental quality, and lastly, greater access to immunizations and healthcare. Healthy People 2020, they have 26 indicators. They're leading health indicators, and they're organized under 12 topics. The Healthy People 2020 12 topics are access to health services, clinical preventative services, environmental quality, injury and violence, maternal, infant, and child health, mental health, nutrition, physical activity and obesity, oral health, reproductive and sexual health, social determinants, substance abuse, and tobacco. There's a link on the slide to Healthy People 2020, but I also provided the link in the text version of this PowerPoint so that you can access it if you would like to look at it. The nursing shortage. The nursing shortage is cyclic. We'll have a nursing shortage, then it will get better, and then we'll have another nursing shortage, and that's been throughout time. There's a nursing shortage that's predicted to last until 2020. Other things that happened with us with nursing is the Magnet Nursing Services Recognition Program, and that identified and studied hospitals that promoted and sustained nursing practice. So now hospitals are trying to obtain magnet nursing services, and what happened there because of that is that hospitals were not hiring ADN nurses for some time. I believe that's changing now, but we'll have to wait and see. Nurses, so we also, and Magnet Nursing Services also helps to retain nurses. Nurses leave hospitals because they're frustrated with inefficiencies and conflicting priorities, the environment of telling nurses what not to do, nurses not being able to implement talents that drew them to nursing in the first place, and feeling of having no voice. So the Magnet Nursing Service Recognition Program addresses that. According to an article in USA Today, the Bureau of Labor Statistics projected a 19% growth in employment for registered nurses from 2012 to 2022, compared to an 11% average growth rate for all other occupations. The demand for healthcare is expected to increase here because of the number of baby boomers and the Affordable Care Act. Nurses, in addition, nurses that started nursing in the 1970s are getting ready to retire. There is also a shortage of nursing faculty because of low salaries. There's not enough money to entice nurses to leave well-paid hospital jobs. I also provided the link to the USA Today article in the text version of the PowerPoint.